Hi friends, nice to be with you through this wonderful medium called Lybrate. Today I am here to discuss with you one of the most common, irritating and nagging problems which in common language we call as piles, or in medical terminology we call them as hemorrhoids. Bleeding piles or hemorrhoids is one of the most common problems in our society. It has evolved, the presentation has changed, and the number of patients getting affected by this problem continues to be very high. It affects males as well as females in equal number. Early age group and late age group both are included in this irritating problem. The main issue with this particular disease is that a lot of people in our country still feel a little bit inhibited and ashamed to discuss this problem. Now, what are basically hemorrhoids or piles? They are basically nothing but venous or small veins which are there in our rectum and anal canal, which over a period of time, for some reasons known and unknown, become prominent, dilated, thin-walled, and then with every episode of passage of stools, there is bleeding. One of the most important symptoms, bleeding, whenever it occurs more than once or twice, is never to be ignored because we could be dealing with what we call as hemorrhoids. Classically, hemorrhoids never cause pain. It will be a painless bleeding, and if it is associated with pain, then we must keep an option of fissure in association with hemorrhoids. Fissure is nothing but a cut onto the rectal wall or the anal canal wall, which at every point of time of passage of motion will produce pain, bleeding, and after that some variable amount of burning sensation. This problem does not need high funda stuffs like CT scans and MRI. We can do away with the diagnosis of hemorrhoids and fissure with a good clinical examination. In some patients with extreme age group, we do recommend sigmoidoscopy or a colonoscopy, which are basically an outpatient endoscopic tests. No higher level of investigations are required in these particular patients. Well, the treatment of hemorrhoids varies. It comprises of some medical treatment in terms of medication, tablets, syrups and other things, and surgery. Small hemorrhoids, what we medically call them as grade 1 hemorrhoids, rarely require treatment. Grade 1 to grade 2 hemorrhoids, they may settle down temporarily with medical treatment in terms of some syrups which reduce constipation, antibiotics and some analgesics. The remaining patients of grade 3 and grade 4 definitely need operation. Surgery can be done in various methods. There are newer techniques. One of the popular newer technique is what we called as a stapled hemorrhoidectomy, and then there are conventional techniques. In our mammoth experience of last 10 to 15 years, irrespective of technique, if the surgery is performed safely in an experienced hand, it rarely produces symptoms again, recurrences are less and complications are fewer. I recommend all the patients who are in regular working hassles not to delay these symptoms. Try and see at which level your hemorrhoids are and choose an appropriate treatment from a good competent doctor. As I have said earlier, and in many instances, simple diseases become complicated when they are ignored or they are wrongly treated. My sincere request to all of you is, do not ignore bleeding per rectum. Have a quick, correct diagnosis through a good doctor, and don't get unnecessary jitters by listening to the word surgery. Hemorrhoid surgery has become safe and is very, very complication free in safe and experienced hands. Thank you.